This family health and wellness segment is brought to you by GlaxoSmithKline Consumer Healthcare.
Pain, headaches, and fever? Take one MedLemon hot medication in the morning and one at night to feel sharp again.
Most of us are likely to suffer from some form of cold or flu this winter. So whether you're the sufferer or the person who's trying to avoid contracting the illness, I have with me today the lovely Dr. Lerato Masemola, who's going to share some of her tips on how to stop the spread of infection. From my experience, I know that if one member in my family gets a cold or flu, there's a very high chance that I will get it too. Now, you tell me, how can we stop the spread of infection in the family?
You're quite right, Anushka. You know, as a mom, I'm sure your children are always touching you. It's kiss time, it's hugs all the time. It's almost unavoidable, but you can always make sure that other areas in the house are sort of disinfected and infection-proofed. For example, the kitchen. Surfaces must always be wiped clean after preparing food. Spills must always be wiped up. Kids playing outside, when they come back into the house, they must please wash their hands from playing with pets as well. Just encourage the little ones, to always have a basic hand hygiene. Keep wipes and tissues in strategic areas, the lived-in areas, where you can access something to wipe up before you can get to the basin to wash your hands.
On that note, what is the correct way of washing your hands, and why is it so important?
I'm so happy you asked, because a lot of people wash their hands but they don't do it correctly. And the first step, Anushka, is to wet your hands and soap up. You give those hands a good rub palm to palm, and the back of each hand properly, a few seconds. And then you interlink the hands and rub between the fingers, and then you can just wash the thumb separately on each side. And then the last step you do is to wash the hands with the tip of the fingers each side, making sure that you're getting rid of all those germs. And it's quite important to remember that you need to wash your hands at relevant times, before and after you eat, when you go into the bathroom afterwards, playing with the pets outside, touching anything that's dirty, mopping up spills. If you're coughing or sneezing and you happen to do it into your cupped hands, then you should also wash your hands. Now I'm going to rinse off and wipe up my hands. In short, there's never actually a wrong time to wash one's hands.
Now, it's considered polite to cover your nose or mouth when you cough or sneeze. Why is it important to do so when you have a cold or flu?
Well, it's not only polite, it's actually in the best interest of public health. Imagine somebody who sneezes and propels germs beyond 3 to 5 meters. But here's an even a better thing to do when you're coughing or sneezing. Sneeze or cough into your sleeve, because it's not always a first point of contact when meeting somebody, or sneeze or cough into a tissue that you can throw away into a closed bin or flush it down the toilet. And remember, if you sneeze into an open sleeve, you need to go wash off that area.
You spoke earlier about disinfecting surfaces. Now, what else should you disinfect, and how often should you do this?
Well, here are the main culprits of infection spread: your keys, your cell phone, the tablets, toys, TV remotes. Items that you touch often on a daily basis should be disinfected, preferably after every time you use it, but it's not always practical, but at least daily.
What is the correct and proper use of tissues, and how should you dispose of them?
Well, I prefer tissues that come in pop-up boxes, because then that way you avoid touching the tissues that are left behind for the next person to use them. And after you use a tissue, you need to fold it up and throw it in a closed bin, or throw it down the toilet and flush it.
All these steps aside, you've taken all the necessary action, but you feel now the onset of a cold or flu. What should you do?
Well, you should actually just make sure that you stay away from other people to avoid giving them the infection. So stay home, rest, lots of fluids, lots of healthy food. And if you don't feel better after 3 to 5 days, then it's always a good idea to see your doctor about it.
Okay, thank you, Dr. Masemola, for sharing your interesting views on this topic. And I'm sure a lot of our viewers out there would have benefited from your wisdom and knowledge. If any of our viewers have any questions or queries about this topic, we suggest you consult your medical practitioner.
Introducing new 18-pack MedLemon hot medication. Bigger pack, greater value. Feel sharp with MedLemon.